county reports. You're one of two. What is it? Lewis? Hi. Pleasure. Oh, thank you. You came from down from Oshai. Yes. Hello, Dave. Okay. Hi, everybody. Okay. Why don't I was going to say it, but I didn't mean it the way it would come out. I was going to say yes. Why don't we get some of the workers? Why don't you just come stand behind us? It's always good when there are people there, so people see that there are people. Good to see you. Yeah. You don't have to say anything, and you don't even have to smile, because you got your masks. Great. Thank you. Come on, folks. Come on, everybody. Good. Okay.
And David is going to kick things off.
Oh, Dave, we're going to kick things off.
Well, welcome everyone to Wyoming County Community Health System. I'm David Kobus, the CEO here, and it's my distinct pleasure to introduce to you the senior senator from New York, the majority leader of the United States Senate, Senator Chuck Schumer.
Thank you, Dave, and welcome. Glad to be here, and I want to thank everyone for being here. Now I'm allowed to take off my mask when I speak. Those are the rules. And I want to thank Dave for the good job he does. We have Dr. Michael Minio, Chief Medical Officer of Kaleida Health, on behalf of Oshai. As many of you know, Wyoming County treats the immediate kids who have RSV, what is that middle word, the S? How do you say it? Syncytial. Okay. Respiratory syncytial virus. What does syncytial mean?
You're asking the wrong guy.
Okay. We also have our great chair of our Board of Supervisors and the town supervisor here in Warsaw, Becky Ryan, who does a great job, and we work very closely together. In addition, Brian Kell. Where's Brian? Is he here? Thank you, Brian, our supervisor from Attica. So thank you for being here as well. And Cindy Appleton, Warsaw Village Trustee and Deputy Mayor. Hi, Cindy. Thank you very much for being here. Before I begin, last time I was here, I was in Buffalo right after the snow. I said I held up a Bills jersey, and I'm not gonna, it's in Buffalo I can use words I don't use here. But I said, you may have seen it on TV. I said the Bills were going to kick, and I used the word that began with A, but we'll say here in rural Wyoming County, butt. They were going to kick butt. And I was glad that they again kicked butt last night. They did a great job. It was great to see Josh Allen. His arm seems fully back. And the defense did very, very well, even without the great number 40. We'll be back, I hear, in 4 weeks. So go Bills, go Bills. But today we're here on a very serious, and you all know I worked very hard years ago to keep the Bills in Buffalo when Mr. Wilson died, and they were going to move. We all got together and made sure they stayed here, and now we've all been vindicated because they're great. Okay, so last year I was here at Wyoming County Community Hospital to announce my push to secure $1.8 million in pandemic aid for the hospital to deal with the Omicron surge. We succeeded in getting that money.
I'm sorry, I didn't quite catch that.
Repeat it.
Okay. All right. To deal with the Omicron surge. We succeeded in securing that critical funding for Wyoming last December. It brought the total amount of pandemic aid that I helped secure for WCCH to over $6.4 million so far. I believe in our hospitals. I believe particularly in our rural hospitals because they're under greater strain than other hospitals. We want people in rural Wyoming, you know, in Warsaw, Perry, to have as good medical treatment as somebody who lives in Buffalo or Lancaster or Orchard Park. But since there are fewer people, it's harder. So, you know, in a densely populated area, you can buy one of these very expensive MRI machines or CAT scans and run them 24/7 almost. Here you don't, but the cost of the machine is the same. It's also a lot harder to reach people. The ambulances have to travel longer, et cetera, et cetera, et cetera. So I have been the leader in the Senate along the, this is sort of interesting, cute. There are two Charles E's in the Senate. Charles E. Schumer, Democrat of New York, and Charles E. Grassley, Republican of Iowa. And we're the two leaders in helping rural hospitals. And actually, New York has more rural population than Iowa. You wouldn't think so. Not percentage, but actual number. So in any case, I've always helped our rural hospitals. And I was here last week with the snowstorm, which slammed western New York. But cold weather isn't just bringing historic snowfall to upstate New York. It's bringing something that could be far scarier, and that is RSV. I'm not going to say it right. Respiratory syncytial thank you so much. Respiratory syncytial virus, a disease for which most adults is like the common cold. We've all gotten it. Every one of us has probably gotten it. Is that right, doctors? Yeah, probably. But for young children or the elderly, it can be much, much serious. And as somebody who has a beautiful little granddaughter at 5 months, I very much worry about it. She had a cold last week. And your first inclination is, oh golly, I hope this isn't RSV. And so it's tough on the little kids. But we have to treat them. And that's what comes in here today. So in Western New York, and with great hospitals, rural hospitals like Wyoming County Community Hospital, or more urban hospitals like Oshai, have both been overwhelmed with huge spikes in RSV cases for kids. And this increases waiting times at the emergency rooms, there are backlogs, and in tandem with the rise in flu and COVID, it is straining our healthcare providers in ways they haven't seen in quite a while. So listen to some of the statistics for Western New York just in the past month. First, this is by far the busiest RSV season that Western New York hospitals like Oshai and like Wyoming County have seen. At Oshai Children's Hospital, which serves Wyoming County because the more serious cases from here are sent over to Oshai, at Oshai Children's Hospital, they have had over 1,000 pediatric RSV admissions just this fall. A typical 6-month season would be about 4 months. So in this a shorter time, and it's already 2.5 times as big. 70% of the patients with flu-like symptoms test positive for RSV. For flu, in just the past 4 weeks, between October 24th and November 20th, they've had 1,171 positive pediatric patients, kids. That's an 800% increase over last year. Plus, flu admissions are up nearly 200%, and we've only begun with the flu season. It just really gets big in about October, I guess. So, by the way, I hope everyone here and all your listeners have gotten their flu shots. It's effective and it works. I got mine. Doesn't even hurt. Don't worry, it doesn't hurt. That's one of the things I'm interested in. When I was a kid, the needles really hurt you. And so people don't like needles even when they get to be older. But the new needles don't hurt you at all because they're so much thinner. But, okay, anyway, that is my brief medical advice. Don't worry, it doesn't hurt. Anyway, the increase in respiratory viruses has led Oshai to set up 5 overflow areas, which they're continuing to use to this day. Now, Wyoming County Community Hospital's health system has reported 50 new cases of RSV alone in just the first 2 weeks of November, 115 pediatric RSV cases this year. Pediatric COVID cases are up 75%. Pediatric influenza cases have gone from just 3 last year to 24. And as I said, as a grandfather of 2 little kids, one more on the way, God willing, in late January, but as grandfather of 2 beautiful grandchildren, Noah, who's 4, and Eleanor, who just will be 6 months in a couple of days, there's nothing more terrifying than the thought of them getting sick. I think I worry about it more as, I don't know if any of you are all so young, but I worry about it more as a grandfather than I worried as a parent. It's weird. And I think it's because you're not with the kids all the time, so you think about it. When you're with them, you say, okay, anyway, whatever. Another digression. But it's terrifying to parents to know that their kids might get something serious. And all across Western New York, parents are facing hospitals who are pushed to the brink, increased waiting times, full beds, all the while their child is struggling to breathe because of RSV. And I've known people whose babies are only a few months old and are spending more than a week in the hospital because their little babies have suffered collapsed lungs and they need oxygen assistance to breathe. Their parents keeping vigil, staying up all night next to the hospital crib. It's terrifying and frightening. I'm sure everyone here probably knows someone with a similar story. That's how widespread this RSV is. So, today here in the village of Warsaw, and the town, right? We're in the town and village. I'm calling on the U.S. Health Department, U.S. Health and Human Services, to take immediate action to get Western New York and upstate hospitals the support they need to take this wave head on and keep all of our kids safe. HHS has authority. They have emergency authority to help in scenarios like this. So I'm calling on them to be ready to send it the second the hospital needs it, especially with cases that are going to rise in the coming months. The feds have to be prepared on a moment's notice. If a hospital like the one we're at today says, I need help, I want HHS to say they'll be there tomorrow. And right now, the law allows the HHS to provide support. First, they can actually send additional doctors and medical staff to hospitals that need it the most. When the level of care needed is here and the amount of personnel is here, they can actually send personnel on emergency, not a permanent, but a temporary emergency basis to the hospitals. They can, it's called staff surging, and whether they're federal employees or sometimes they waive credential requirements to move personnel across state lines. In other words, let's say there's a hospital across the border in Pennsylvania, in Pittsburgh, has enough doctors. They can say, okay, we'll let you temporarily practice in New York even though you don't have a license to practice in New York. Okay? Second, they have supplies and structures. Some hospitals, they've already built these little temporary facilities, that are like tents, but with heating and all the medical stuff it needs, or other types of equipment, breathing equipment. They can send that stuff here if there's a shortage, okay? Just on the hospital, on Mr. Klobus or whomever else asking. And third, they can enhance the use of telehealth, which we've seen has grown dramatically, particularly in rural areas, and we put about $7 billion into our last budget bill to provide more telehealth, permanent telehealth, with a special set aside for rural hospitals. You'll be able to apply for that quite soon. But in any case, it can. What does that telehealth mean? Well, first, worried parents can speak to a provider right away, and the ability to reach somebody and report to them the symptoms or even show them the symptoms via telemedicine is very, very important and relieving. It can also help overwhelm doctors and nurses in hospitals with pediatric specialists being able to advise emergency room workers on their patients. Okay? Let's remember, many of our rural and smaller hospitals, how many beds are here? 62, which is a smaller hospital. How many Oshai has? 185, so you can see the difference in magnitude. They're not set up to care for a huge influx of the kids that require ventilators, other extreme medical interventions. So they send them to hospitals like Oshai, but then Oshai is short. So we need help for all of our hospitals, our urban, suburban, and rural hospitals. The good news is that RSV is very treatable. If you get the right treatment, the odds of returning to a safe, healthy childhood with no permanent damage is extremely high. But you got to get people the materials they need. Okay? There are reports that a vaccine may be as ready as soon as next year, God willing. But for now, this is all we have. And we can't have a preventative vaccine, so we need to provide the best possible treatment. A hospital like Wyoming County is known for giving outstanding care, so is Oshai, but we got to help them during this particular crisis. So, I'm not alone in asking for this, but I'm using my clout as majority leader to get them to act. Last week, the Children's Hospital Association and the American Academy of Pediatrics warned of unprecedented levels of RSV combining with increasing flu circulation, and they said it's pushing hospitals to the breaking point. They urged that this be done. So I'm here to tell HHS, start addressing this ASAP, to keep children in Western New York and Rochester, across upstate New York, safe this winter. And so that's what we're doing, and I will use my clout to make sure that it's available when any hospital in Western New York or in anywhere in New York State calls on people to need. So now I'm going to call on Michael Minio, the Chief Medical Officer for Kaleida, representing Oshai, to share his remarks. Thank you, Michael.
Thank you.
Did you ever hear of Sal Minio?
I have.
Oh. Who has? Who of you younger people?
Thank you, Senator. I'm Dr. Mike Minio.
You're not related.
No, but lots of patients have asked me about it, which led me to Google them, which is how I learned about them.
Yeah, he was a great early rock and roll singer.
1950s,
Yes,
the original James Dean.
James, that's right.
I'm Dr. Michael Minio, Chief Medical Officer of Kaleida Health, which includes Oshai's Children's Hospital. A typical RSV season, respiratory syncytial virus,
Syncytial virus.
spans from November to April. In a typical year, we'll get about 250 admissions, so children sick enough to be admitted with RSV. We're already over 1,100. We peaked at 150 cases in 1 week time period, actually being sick enough to require admission. We're starting to see just a little dip. The challenge is we went from 150 to 100. At the same time, we went up to 50 influenza admissions. Keep in mind, we typically only have 70 influenza admissions an entire season. The net result is a really strained building and workforce. We have a hospital that is consistently at 120% capacity. We have a 20-bed pediatric ICU unit. So that's when the kids are really sick. That is consistently over capacity, 22, 24 patients, requiring that we house patients in the post-ambulatory care area or the emergency department. Our team has done a great job coming together to solve this. We've opened up 5 overflow areas. We've turned the area in front of our cafeteria into an extended ER bed for the less sick children. But we can only do so much. It really does take the community to come together. It's going to require all of us getting vaccinated, making sure our family and friends are vaccinated.
Right.
But also requires community support. The hospital system and our teams are coming through COVID. They're exhausted, our resources are depleted. So we're very grateful to the Senator and his strong advocacy to help give us the resources that we need, that our exhausted team needs, to be successful to care for our children. To care for the children at Oshai Children's Hospital, but also to take care of the children from the 8 counties of Western New York and beyond. This is straining all the hospitals. We're getting requests to take children from Syracuse, Rochester, Albany. All the children's hospitals are working together to provide care, but we still need more resources. So thank you,
Great,
Senator.
Thank you. And Michael makes a point which I didn't underscore, which is this is not permanent. They're not going to send a doctor permanently here. But for the few months where things are peaking, that's when it's needed, and we'll do the most good.
Thank you.
Great. And last but not least, we have, as I mentioned, we have a great county supervisor. She's chairman of the board of county supervisors, Becky Ryan, who does a wonderful job, and we always work across party lines to get things done. Becky.
It's so good to see you
Thank you,
again,
Becky.
too, and have you here. You've been a great friend to Wyoming County, and we appreciate it. And I'm so glad that you're here at our hospital. Our hospital actually employs over 600 people.
Wow.
It's our biggest employer in the county. And as you mentioned, rural hospitals are stressed. Going through COVID without having to be able to have the revenue-creating surgeries.
Right.
We're trying to rebound. And there's a shortage of nurses and healthcare workers because during the COVID pandemic that we didn't have the schooling
Right.
to
Right, good point.
produce more. So that's probably going to be at least a decade, I think, to get
build
back
it
on
back.
track. Yeah. So anything you can do to help us on that end
I
too,
will.
we'd appreciate it. But again, thank you very much. I know that you're here at least once a year.
Oh,
And
more,
we,
right.
we are happy to see you and that you're a patron of our airport too.
Thank you, Becky. I
Yes,
am.
yes.
And I help the airport out.
Thank you.
Okay, so I don't think we have any other speakers. The great Chris Zeltman, who runs our office, takes care of Wyoming County, and many of the other adjoining counties, is here. And I'm ready for questions from the media. And I think I'll call on first someone named David McKinley, who's I'm looking at the corner of my eye.
Senator, you said in a quote, you want to use your clout to get them, HHS, to act, and to HHS, start addressing this ASAP, which would seem to indicate you feel they're not.
No,
Are they
it's not.
somehow not addressing
It's
this?
not that they're not, but the flood of calls here in New York and around the country will start up in the next few weeks because the combination of flu and RSV is just overwhelming. So I just want to make sure they're ready. They have, a couple of hospitals have called them and they have been responding, so I don't want to give the impression they're not. But they're going to have to ramp up because they're going to get a lot more calls.
All right, and is there any representative of this hospital, this one right here, that could tell us whether you are overwhelmed with cases or understaffed at this point?
Yeah, we don't, we're not licensed to take pediatric patients, but we
Oh.
see them in our ED, and we have seen an increase. But those patients that are typically sicker, we ship to OSHA, so they bear the brunt of these patients that we see here in Wyoming County, pediatric patients.
Do you ship them to Rochester too?
We do, but the majority go to OSHA because they're a regional referral center. I'm sorry,
Hard to
they're a
hear.
regional referral center.
Yeah. Could you identify yourself, please?
I'm David Kopis, I'm the CEO here at the hospital.
Senator, when you talk about sending doctors or equipment into some of these
Or nurses, yeah.
or nurses into these rural places, where are they coming from? The cities, New York City?
They
and-
come from, there are certain places that are not overwhelmed by this illness or have had ample personnel. Some people were hit harder, as Becky mentioned. Some people are hit harder, have been hit harder, and others by COVID. So the HHS is nationwide, and they have an inventory of where there's personnel that can be spared in their own areas to come here.
Do you
How
think?
soon before you see actual boots on the ground or resources?
As soon as these, what I will monitor, and my health folks in Washington will monitor, is as soon as somebody asks, we want to make sure that relief is there right away. That's the purpose here, not 2 weeks, or they got to do paperwork. They got to be ready because they're going to be asked.
Senator, is there like any plans in place for hospitals in underserved areas as well?
Yes, there's a bill actually called, what's the exact, what's the word that we get rural money for?
Low volume?
What, low volume,
Low
that's the
volume.
term they use. This is one of those, first of all, I want to give Wyoming County a lot of credit. This is a municipal-owned hospital. It's owned by the county. Only 2 of our 62 counties have municipal-owned hospitals. Well, actually, New York City does. So 2 of our non-New York City of our 57. And they are this county and Lewis County, which is up in the Adirondacks. So it's the county legislature that's in charge. But there's a special program that I have pushed very hard with Senator Grassley called Low Volume. And that is, we're going to get that in the omnibus budget that's going to come up in December.
Okay, thank you.
Do you think that, there may be a need for HHS to send medical personnel across state lines? Do you think it's time for the state to offer the jobs back to the 34,000 healthcare workers they fired because they wouldn't get a vaccine, which turned out doesn't actually prevent you
Yeah,
from
well,
getting
on a decision like that, which is a healthcare decision, I leave it up to the medical authorities as to what the right thing to do is. I mean, if they find that the danger of having someone unvaccinated exceeds the benefit that they provide in healthcare services, it's their decision, not mine. And I've always done this. On all of these types of issues, I haven't said, oh, you must do this or you can't do this. I left it up to medical authorities. Okay? Any other questions?
Yesterday, with the vote on
We're going off topics, okay? Go ahead.
yesterday with the vote on the rail
Yes.
contract, you didn't get the 7 paid sick leave days in there, which is a sticking point in the original negotiations anyway. So what's to say the unions decide they don't wanna go to work anyway, if the employees decide they don't wanna.
Well, I think the unions will. First, of the 12 railroad unions, 8 supported this agreement. Now, I am all for the sick days, and I voted, we had a vote on whether to extend and give folks 7 sick days. It got 52 votes, but it needed 60. And so it didn't get enough votes. But the danger of a strike would have been far greater, because we depend on rail for everything. Let me give you one little example. A lot of localities in New York depend on chlorine that has to be fresh and shipped and is decomposable to come in, and it comes by rail. If that stopped coming, you couldn't have drinking water, safe drinking water. But the examples can be repeated over and over again. So I thought a strike would be damaging. I had hoped that the legislation to require the sick days would have been added, but we're going to keep fighting to get the railroad workers the sick days. I believe they deserve them.
Senator, how difficult is it with not just yourself but other people in Congress to kind of push this through, to see that this legislation goes through to end this railroad strike when, you know, a lot of the union workers, and you've been in support of unions along with other colleagues?
My grandpa worked in the paper mills in Utica, New York, and was one of the founders of the Paper Workers Union, which was founded in Utica in the 30s. Yeah, so we're going to keep working to try and push it through, and I know the Biden administration is looking to see if they can require an administrative.
Do you have any thoughts on this artist formerly known as Kanye, I guess, and his anti-Semitic
Well, look,
trope lately? It just seems like he's gone off the edge or something.
yeah, I saw even that Twitter now is not. I think I saw that in the newspaper this morning. But look, any kind of bigotry should be roundly condemned. And I was very glad to see. I don't want to make this too partisan, but many of the close supporters of Donald Trump actually condemned him, including Mitch McConnell, for sitting down with Kanye West and that other bigot. Okay? Okay. Thank you, everybody. And a Merry Christmas, Happy New Year, Happy Hanukkah, Happy Kwanzaa, Happy everything to everybody. Thank you. Festivus, too, right.